Hi, I'm Dr. Shook, chiropractic physician here at Hickory Spine, and today I want to talk to you about car injuries and some of the things that you need to consider if you've been in an auto accident. So number one, if you've been in an auto accident and you have an injury, the most common complaint that we hear about and the most common injury is whiplash. Now, whiplash is usually where you have neck pain, and there's a lot of other symptoms that can be associated with it: back pain, headaches, sometimes there's numbness and tingling, and really, what a whiplash is it's torn muscles and ligaments, and that can create a number of different symptoms. And a lot of times this is considered as a soft tissue injury, but what we have found and what we know is that the most common injury is a ligament tear. Now, ligament tears are called sprains. There's different degrees of sprains that can occur. And one of the things that we do in our clinic that's different is we take very specialized digital x-rays and we use a computer program to help us analyze them so that we can determine the severity of ligament injury that you've sustained. This is probably the biggest gap that I have seen and that I have observed in the working up and diagnosing of injuries related to automobile accidents. And I think we all have met someone or know someone that has experienced problems, and they say, after the car accident I was never the same, or they say that there was a long-term problem. And even though these people get told, you've got a whiplash, just take some anti-inflammatories, muscle relaxers, and give it time, it'll get better. What you have to do is you really have to measure. Like we can take specialized x-rays where you bend, like let's say we're looking at the neck, you bend and we take an x-ray from the side, you look up, and you go to the end range of motion, we take another x-ray. And what that allows us to do is it allows us to measure the movement of the bones of the spine. There are normal ranges for that movement. If you are beyond those ranges of movement, if the bones move excessively, then we know that there's been a grade 2 or greater ligament sprain. That's not good, because ligament tears and ligament injuries are permanent. And we want to make sure that we understand the extent of your injuries so that we can better, first of all, figure out how to help you, and then also give us a better idea of your long-term ability to recover, because we want to prevent long-term injuries. We want to help you in the short term to get out of pain, to improve your function, but then also long-term to avoid a permanent injury. We utilize a lot of different therapies in our office. We work and co-manage patients with numerous doctors, from orthopedists to neurosurgeons to pain management physicians. We can help you to get MRIs if needed, and we can really help you to really make sure that you get the care that you need. And it starts with a really good exam and workup, which is what we try to do for you. So if you have any questions or if you need any help, if you've been in an automobile accident or collision, then you may want to have a thorough workup or a second opinion about your case. Then just give us a call. We would be happy to. I'd be happy to give you my opinion on what's going on with you and see if I can't help you out. But I appreciate you. Hope you have a wonderful day. You can reach us at 828-324-0800, or you can find us online at hickoryspine.com and learn a little bit more about what we do. But I appreciate you. Hope you have a wonderful day. Look forward to talking to you soon. Thanks.